Hello, I'm Lisa Welsh, and I was the Communications Manager for WAS 2021. Today, I am delighted to be joined by Shingai Mutambirwa, who is going to share with us a little bit more about his presentation. Welcome, Shingai. I'm so happy to have you here with me today.
I'm happy to be here as well, Lisa, and thank you for the invitation to join WAS conference. It was absolutely brilliant, and there were so many good posters and presentations that I think everyone should really have a go for that as well.
I completely agree with you. Please, could you share a little bit more about who you are and the work you do for anybody who's not familiar with your work?
Yeah, my name is Shingai Mutambirwa. I'm professor and chair of the Division of Urology at one of the 8 university hospitals in South Africa. Mine is called Sefako Makato Health Sciences University, and it's affiliated to Dr. George Mukari Academic Hospital in Pretoria. We are the second largest hospital in South Africa after Baragwanath as well. And one of the things that we do a lot with is sexual health, but also cancers and other urological conditions. So my presentation was really just trying to improve the information, I suppose, about the fact that sexual health is such an important part, not only of for individuals, but for general health and population health as well. We know that the 2 leading causes of death in worldwide are cancer and cardiovascular disease, and both of them are related to each other as well, because we know the more people who have cancer, the more likely to get cardiovascular disease. But also, cardiovascular disease is the causes for, like, for example, inflammation, are one of the causes of sexual dysfunction, both in men and in women. On top of that, when we do procedures or we give treatments, such as example, when we have prostate cancer and we get rid of the man chemical testosterone and deprivation therapy, that can massively impact people's sexual health. Similarly, for females, with the arousal and dryness that happens when we're giving radiation for bladder cancers, etc., can be a massive issue as well. So I think it's important for us as health practitioners as well as patients to recognize that there's a huge impact on sexual health. And on top of that, if we do manage the sexual health of our patients, we're actually going to improve their longevity when it comes to cancer, as well as cardiovascular disease.
Wow, so you're really zooming out and looking at the whole picture and encouraging others to do the same.
One of the things that came up, particularly from all the panelists when it came to cancer and sexuality, is that everything is interrelated. If you have the general good health, you're going to have better sexual health, and you're going to have less likely to die from heart attacks and from cancers. And I think the pointer is really that it's just about 5 things that you really need to do to make your sexual health better, to make your general health better, to decrease your cancer risks. Number 1, a decent diet, not in numbers, in types of calories, but the numbers of calories. You have to decrease that. Bit of exercise improves almost all outcomes, both for cancer and for general health. Not smoking. Smoking increases the risk of basically every cancer, and it's also going to cause you to have sexual dysfunction. We always say that if that stick is going to make the man's stick go down, at least, I mean, probably the female areas as well is also going to have a problem from dryness. Then the fourth one is about stress. We know that we're in a stressful environment at the moment, but stress causes inflammation, which then causes cytokines, which can cause increased risk of cancer, which can cause increased risk of sexual dysfunction. Everything is interrelated. And then the 5th is just trying to make sure that you don't overdo on these substances such as alcohol and various other things. But if you follow those 5 principles, you're going to be protecting your sexual health, but you're also going to be protecting yourself from cancer and improving your outcomes for cancer care as well.
Wow, thank you. It's like an all-round, and the panel was fascinating. I really enjoyed your participation in that, but overall it's something that I think everybody should make sure that they watch. Who do you think would particularly benefit from watching this?
I think it's not only, I think there's a whole bunch of people that are going to get import from this. One is the healthcare practitioners, those who are dealing with sexual dysfunction, and also those oncologists and oncological practitioners who are dealing with patients on a daily basis. But I think even more important is for the patients. I think patient advocacy is one of the most important aspects that we often underestimate. And without them actually having an understanding in a simplistic way, and some of them are more clever than us as oncological surgeons, but the point is that for the general population, if it's very simple, it'll work out well. I always like, I think it's Einstein saying that if you can't explain it simply, you don't understand it yourself. And I think one of the things that came out from WAS is that a lot of the presenters actually explain things so simply that you can see that they understood it, but it also helps our patients as well as our colleagues in the medical fraternity to improve our outcomes for our patients.
Yeah, couldn't agree more. That's true. Some of the best presenters that could just speak these complex issues and just put it out there in a way that makes you think, yes, and you can see yourself in what they're saying. No, fantastic. Thank you so much for sharing your time with us today, Shingai. And I really want to just remind everybody that did register for WAS that you have until the end of the year to go and enjoy this content, to go and consume it, go and watch it. There's so much there. So whatever is relevant to you, please take the time to watch. And if you didn't sign up for WAS, there is still time. You can sign up now and watch everything on demand for only $50. Such an incredible price. So WAS is really leaving
giveaway price for the amount of information you get. That's
undoubtedly, truly. Thank you again for your time, and hopefully we will see more of you in WAS going forwards.
Thank you, Lisa, and thank you to all the viewers as well.